Hello, my dear friends. Today's episode is about alcohol. And I'm not going to say it's harmful. I'm not going to say it's beneficial. I will honestly and unpredictably look at alcohol and its effects on the body from all sides. And at the end of the video, I will tell you what changes will occur in your body if you quit drinking alcohol. What will happen over the course of 4 weeks after you've done this? It's important to understand that there's regular alcohol consumption and there's alcoholism. There are people who are not addicted and consume, for example, a glass or half a glass of red wine every day on the advice of their family doctor, or a shot of something strong to normalize cholesterol in the blood. But there are people who suffer from addiction. You will? No. Remember, understanding that poison and medicine differ only in the dose. To understand this boundary, let's look at history. Even in ancient Greece, athletes loved to drink wine before competitions. It was believed that wine calms the nervous system. It was believed that it was easier for them to perform and that the results were better. Also, before nightly tournaments, knights liked to sip a glass of red wine to perform more confidently in the competitions. Even in ancient Greece, the god Dionysus, he was the patron of athletes, merriment, and wine. Many athletes, including bodybuilders, do the same before performances, if you haven't noticed. They love to have a shot or two before going on stage to feel more confident and calm, although this is not very correct. If you've noticed that a small dose of alcohol reduces your anxiety and nervousness, and you've used it to calm down sometimes, hit like and keep going. According to our review data from the last 5 years, 5% of male deaths worldwide are related to alcohol, and 10% of deaths among people aged 15 to 49 years old. Imagine every 10th death is related to alcohol. This does not mean that alcohol withdrawal means heart attack, stroke, thrombosis, diabetes. That is everything that has appeared against the background of alcohol or alcohol dependence. Many people consume, for example, red wine daily with the sole purpose of getting resveratrol. Resveratrol is a beneficial substance that has been found in wine, in red grapes, and by consuming wine, you reduce the risk of developing atherosclerosis. You reduce systemic inflammation in the body. Actually, the very same resveratrol for the sake of which you consume wine. It was discovered in the year 1963 by a scientist from Japan. But Nomura extracted resveratrol from Japanese knotweed and used it as a folk remedy for treating cardiovascular diseases. And in the year 1992 in France, they noticed that they suffer less from cardiovascular diseases than the average population in the world. And they found that the regular consumption of wine by the French, due to the resveratrol it contains, leads to a reduction in the risk of cardiovascular diseases. But at this moment, everyone instantly forgot about the walnut. It was then that the recommendation appeared that half a bottle or a bottle of dry red wine will prolong your youth and give your heart health. Resveratrol, by the way, has another positive effect. It is a natural anticoagulant. That is, it reduces the risk of developing clots. Let's review the facts we found. The Journal of Health and Social Behavior showed that moderate alcohol consumption can strengthen social ties and improve mental health. People who drank moderately more often had strong social ties and reported a higher level of happiness and satisfaction with life. Probably indeed, because as you know, many issues are resolved over a glass in our country. Many acquaintances are made easier and simpler when you are at some banquet. There will be vodka, there will be vodka. But I, as a person who is not drinking at the moment, can say that it all comes down to just that moment. A person controls himself better when he's sober and allows himself more, relaxes more when he's drunk. But in fact, if you are a person confident enough in yourself, you don't need alcohol to approach someone, start a conversation, or initiate an interesting discussion. But unfortunately, especially in Russia, in Russian culture, alcohol is closely associated with many things, with fishing, with hunting, with going to the sauna with friends, with life in the community with friends. That is, without alcohol, it's really hard to exist in our society. Vodka is the most unique invention of our people. It's not just a strong drink among others. It's a nationality, I would say, a folkness. It's what unites us all and keeps us from total collapse. That's why not everyone can cut alcohol out of their life. Especially, I have many people coming to see me, generals, for example, saying, I can't stop drinking because I have a meeting here today, a meeting there, a meeting. I'm forced to drink, forced. And I live from the fact that I drink, but I can't stop drinking. I drink not because I want to, but because my job forces me to. Unfortunately, many issues in our country are resolved over a glass of rum. What can be said to such generals? What will you answer the generals? You won't answer anything. I understand, but I really understand that this is the case. Especially in business, it's the same thing. In politics, many issues are resolved in an informal setting. Somewhere there, at the cottage, in the bath, over a bottle of wine, champagne. In an informal setting, it relaxes, allows. Yes, indeed, sometimes, unfortunately, in some professions, especially without this, not at all. Another question. It causes 100% harm to the body. When it's by force, when it's independent of whether you want it or not, and you're compelled, it's not very, of course, good. We also reviewed the link between alcoholism and bulimia to determine if there is a connection between the two disorders. I always thought there was, but research showed that there is absolutely no connection. Yes, for those who don't know, bulimia is binge eating. Positive sides research shows that moderate alcohol consumption can improve vascular function, lower bad cholesterol levels, and increase good cholesterol levels. The results of more than 50 clinical studies involving 4 million people have been analyzed. And moderate alcohol consumption, that is 1 standard drink per day, was associated with a reduction in the risk of cardiovascular diseases by 25 to 40%. So it's reduced by up to 40%. I expected the percentage to be lower. A drink is considered anything that contains no more than 14 grams of alcohol. So how much is 14 grams of alcohol in a drink overall? Well, it turns out to be, let's calculate. It turns out to be a shot. Moderate alcohol consumption can reduce the risk of developing type 2 diabetes. This is probably because alcohol increases insulin sensitivity. It's unpleasant to read, but I read because I'm fair and honest with you. Moderate alcohol consumption can have a relaxing effect, which can help reduce stress and improve mood. Well, you can't argue with that. Yes, indeed, when alcohol is present in life, aren't you happier at some event? But last year, like me, I don't consume alcohol. I'm happy enough without it. Now let's move on to the negative aspects. First, there is a causal link between alcohol and 7 types of cancer. Can you name the 7 types of cancer? In addition to breast cancer, alcohol consumption increases the risk of developing cancer of the mouth, throat, esophagus, liver, larynx, colon, and rectum. Can you name the 7 types of cancer? Secondly, low doses of alcohol suppress the synthesis of testosterone. The suppression can be short-term or long-term. That is, you drink a bottle or 2 of beer every day regularly. This does not suppress it by times, but it suppresses the production of testosterone. And if you've gone on a binge, or if you've drunk a liter of vodka today, then you have a sharp decrease in testosterone levels. Alcohol consumption affects the mental and psychological health of men, including increasing the risk of developing depression, anxiety disorders, and alcohol dependence. It's probably also foolish to argue with this because you all know how many people have ended up with themselves because of alcohol dependence. They quit their jobs and ruined their careers. For example, artists, many as you know, have overdosed, smoked, or gone into alcohol dependence. And in the end, a talented person just kills himself at the bottom of a bottle. The most interesting thing is that alcohol suppresses protein synthesis. An hour after taking alcohol, protein synthesis is reduced by almost a quarter to 23%. What about athletes who regularly drink and perform? I believe that an athlete should not drink regularly. If we're talking about a professional, then he should not drink. And if he drinks, then he's not a professional. Because for a professional, everything is about the result. His whole life is about the result. Everything he does, what he lives for. If he wants to be the best, it's only without alcohol. Sports without alcohol, sports and alcohol. If it's some kind of leaderball, then it's incompatible, such a word, then it's incompatible. Now I'll take a small comment from my friend, a professional in his field, Oleg Irishkin, a candidate in medical sciences, endocrinologist, dietitian, and my good friend. Listen, we're filming right now. We're talking about alcohol and about the good properties of alcohol and about the bad ones. That is absolutely honestly. And I have a few questions for you as an expert. First, overall, is alcohol harmful to the gastrointestinal tract? Yes, indeed, alcohol. Any amount of alcohol worsens the condition of the microflora of our intestines. That's a fact. Oleg, what's your second question? Dietitians probably recommend, like some doctors, a glass of dry red or 50 grams of something strong. So, in your opinion, what is the minimum safe beneficial dose of alcohol? If yes, what is it? Yes, indeed, there are recommendations, clinical recommendations, European, American, again, different recommendations, in which it is said that indeed there is a safe dose of alcohol. This is for recalculate for dry wine. 140 milliliters for women and 240 milliliters for men, with a caveat, not every day. If we are talking about recalculating to strong alcohol, there will be about 40 milliliters. Tell me, how are alcohol and weight loss related? Very categorically bad. There are men, most often mature men, who have achieved great success in life. Big, chubby, they have a bottle of wine every day, and I consult them, I lead them. Weight doesn't decrease well on alcohol. That is, alcohol and weight loss are still paradoxical things. Oleg, thank you very much for getting in touch, giving your comments. My subscribers also send a big thank you. Let's move on to the interesting facts. Daily consumption of non-alcoholic and alcoholic beer increases microbial diversity and causes dysbiosis of the gut. Many of you consume non-alcoholic beer, and by the way, often ask me, is it harmless? As you can see, it's quite harmful, but especially alcohol. It reduces the barrier function of the intestine. That is, toxins penetrate more easily. The microflora works worse. That's why many diseases, especially skin diseases, immune diseases, they are directly related to the health of your microbiota, to the health of your gut. If you drink, if you have dysbiosis, then the first step to normalize your flora, to clear your skin, to look and feel better, or to get rid of autoimmune disease is to quit drinking. Drop the bun, your pascuda, jumped, go to the hall. Rasa, candies, tea, here sporza, came to me joke. Alcohol consumption increases the hardness of arteries and accelerates human aging. The effect of separated twins. Identical two people look fundamentally different if one person regularly and often drinks and the other does not drink. By the way, this also applies to nutrition and smoking. Therefore, not everything boils down to genetics with the same genetic material. Your life can make you healthy, beautiful, likable, and if you take a dismissive attitude towards this. And besides, despite the fact that you eat everything in a row, smoke, and also drink, you will look worse. This is direct evidence of this effect of separated twins, that besides genetics, it's very important. Epigenetics is how you use your genes, because it's your behavior here today and now that affects the activity of genes that you can't change from birth. But you actively influence their activity every day with your lifestyle. Photos of examples of separated twins and a number of other interesting studies are in the ether, the link to which is under this video. The ether is absolutely free. Go, watch, benefit. The ether is called 7 Secrets of Testosterone. And besides testosterone, we generally talk about the lifestyle of a modern man. We discuss many interesting topics thoroughly. And there I also talk about my project for Men Fitness as a Science. Simultaneous consumption of alcohol and cigarettes is very harmful. If you drink and if you smoke at the same time, then the risks of developing a range of oncological diseases increase in arithmetic progression. For example, if a person consumes 1.5 liters of wine a day and smokes more than 15 cigarettes a day, then the risk of developing esophageal cancer increases 150 times. Can you imagine? It's 150 times if you drink and smoke at the same time. By the way, the link to this study and many others that I refer to, I will definitely post in my Telegram channel. The link to the Telegram channel is in the description under this video. Alcohol and estrogens. Many say that I drink, my stomach grows because of estrogens, because of beer. In fact, there is no such thing in the studies. Studies show that alcohol and estrogens are not related at all. But in one study, we still found that there is a small connection. But estrogens decrease, they increase. Ethanol increases cortisol. The cortisol surge occurs after 4 hours, and everything returns to normal only after a day. Therefore, if you have problems with your nervous system, I do not recommend you to regularly drink prolactin and alcohol. Here are some very interesting figures. When consuming alcohol, especially in large quantities, your prolactin levels can skyrocket up to 412% and only return to normal after 12 to 48 hours. As an oncologist, I'm often asked why your patients drink. And as our practice shows, indeed people who are particularly struggling with some incurable disease at a late stage, they often try to alleviate their suffering, escape from reality by consuming alcohol. For them, alcohol is an escape from reality. It's a break on the nervous system. And I became interested, what other reasons in principle make people drink? Well, it's probably the desire to belong to some society, like with oncology patients, it's the desire to escape from reality. The third is psychological and physical dependence for those who regularly and have long been consuming alcohol. Let's go from the opposite. And I'll tell you what will happen to your body in the next 4 weeks if you abruptly stop consuming alcohol. Understanding what will happen and why it will happen can help you understand how strongly alcohol affects your body. The first thing you need to understand is how alcohol works. Alcohol binds to certain types of receptors. These are glutamate receptors, and it modulates them, blocks them. What is a glutamate receptor? It's a neurotransmitter. It has an excitatory action. And when you block it, that's what's called intoxication. You're blocking your transmitters that are responsible for your excitation. That's why on alcohol you feel lighter. That's why on alcohol you're relaxed. That's why on alcohol you're less anxious. And it's those athletes who consume alcohol before some start, activity, or approach, do it for this, they are slowing themselves down. As I've mentioned, the consequence of the associated receptors is intoxication. Higher alcohol doses involve more receptors, leading to increased intoxication and toxic reactions. The number of associated receptors is very large. This is a very strong breaking, and it's a lethal outcome. That's why there is a lethal dose of alcohol. If you, break too hard, you break your respiratory function and your cardiac function, and you can actually die from a large dose of alcohol. The lethal dose of alcohol ranges from 0.42 ounces per kilogram of body weight, equivalent to about 10 fluid ounces of 96% ethanol in a single dose. But if you drink regularly and often, you develop a tolerance to it. That's why, for example, someone might get drunk from 1 shot of vodka, while someone else can drink a bottle and you wouldn't even realize they're drunk. By the way, it's a sign that you're an alcoholic if you don't get drunk from a large dose of alcohol. You've just quit drinking the last time you drank. And usually what is called a hangover is not really a hangover, it's detoxification. It's a lack of fluid, it's a lack of electrolytes, and it's also a protective reaction of the body to the poison you've consumed. He's constantly showing you that, buddy, you shouldn't drink this anymore, and you shouldn't drink this much of it. It's poison, and it's going to make you feel bad. So when you're feeling bad, it's your body talking to you. And notice what your reaction is during a hangover, when you're nauseous from alcohol. On one hand, you have an immediate gag reflex. On the smell, you have an immediate gag reflex. You feel bad. You feel heavy. So listen to your body. My dear friends, in the first 14 to 24 hours after you've quit alcohol and it started to leave your body, by this time, there's usually no alcohol left in your blood. You start to slowly recover your immune system. Yes, indeed, the immune system suffers. That's why people who drink somewhere, they are more at risk of getting some infectious disease, which is transmitted, for example, by airborne droplets. The immune system only begins to recover 12 to 14 hours later and will return to normal. Until then, you are at high risk of getting sick. The first symptoms of abstinence will appear in you after 24 hours. So-called loophole. Tremors, hand shaking, sweating, increased pulse, cold sweats, sometimes even unpleasant feelings in the stomach, anxiety, depressive state. These are all signs that you are coming out of alcohol intoxication. Usually this develops after a day. 3 to 5 days after you quit drinking, your stress hormone levels normalize, your blood pressure normalizes, it gets better. Therefore, one of the indications to quit drinking is arterial hypertension. And thirdly, your appetite normalizes. You start to eat less. People who drink want to eat more. 7 days after you quit drinking, you start to look better. People will tell you that you've gotten younger, lost weight. What is this related to? The fact that you finally start to replenish your water supply? People who regularly and heavily consume alcohol are always dehydrated. And all our organs are made up of water. Even our bones are 30% water. They are made up of liquid. When you're dehydrated, you look worse. And alcohol has one bad property that many people don't think about, don't consider. It blocks the antidiuretic hormone. That is the hormone that makes you retain fluid. That's why people who often consume alcohol, they often go to the toilet, and they are in a chronic form of dehydration. Many people, for some reason, think that the recovery of the central nervous system after you have gotten rid of ethanol intoxication happens quickly. Abstaining from alcohol for 2 days doesn't fully reverse its effects, despite appearances. The recovery of the central nervous system after quitting ethanol only occurs after 2 to 3 weeks. After 2 weeks, your kidneys also start to work better, and they start to better remove the products of decay from you, thanks to which you also start to feel better. Yes, the kidneys, to a lesser extent than the liver, but are also involved in the metabolism of alcohol and suffer if you drink chronically. The very first question in Yandex is, can you drink beer with one kidney? Yep. That's what people are concerned about. And the last thing that probably recovers in us, but probably really recovers, is our liver. Remember Prometheus and remember his liver, which was pecked at, and it recovered. This also happens in our profession. We have patients who have a new formation in one part of the liver and in another part of the liver. Only one part of the liver needs to be completely removed practically, and the other part of the liver needs to be partially removed. And sometimes they divide this operation into 2 stages. They practically remove the entire second half of the liver, and from a small piece of liver, a whole lobe grows. In a month or a month and a half, you can safely operate on the second part. The liver has unique regenerative properties. If you quit drinking, in 4 weeks, the process of full regeneration will begin, and in 1 to 2.5 months, it will largely be complete. Of course, if there is no fibrosis, that is, this is the replacement of healthy liver tissue with fibrous, that is, into scar tissue. There are, unfortunately, things that, well, if you quit drinking can no longer be changed. This does not mean that you should not quit. If fibrosis of the liver has already occurred, it means that you quit later than you should have. And when you quit drinking, the liver begins to focus not on removing alcohol from your system, but on removing toxins. And when many of you ask me to tell you the best detox recipe, the best detoxification recipe, the best, my dear friends, toxin removal recipe, it's about not interfering with your kidneys, not interfering with your liver, not interfering with your skin, and letting your intestines do their job. The best way to detoxify is through complete fasting, if there are no health reasons preventing it. You're not adding anything new, just drinking water and giving your organs a chance to rest and expel what you've already accumulated. because you're not piling on additional work for them. All our organs, all our internal systems are designed for much longer runs than we live with you. One kidney is enough for a person to live 2 lives. But with our lifestyle, we manage to so confuse the body that by the age of 50, 40 years, we already become disabled. It's all in your hands. Depending on how carefully you treat your body, you will meet your old age differently. And many of us are drunk by parents or grandparents. It's easier for us to understand willpower. Pull yourself together. Don't drink. What is it? How to reach the older generations. Is it possible to reach them? How can we talk to them to care about their health? In this regard, no way. Because I, for example, am not an authority in medicine for my mother. She is also a doctor, but my medical advice to her is like a voice in the wilderness. However, if a neighbor without medical training gives advice, that's a different situation and is acceptable. I have always been and will always be a child to her. And therefore, unfortunately, this does not sound sad to our parents, as it were. We want to take care of them more than anything, but they trust and see authority in us, not least of all. Therefore, of course, there is a very difficult problem here. It's a very difficult problem to treat our parents, to help our parents. Many come to me for consultation, bringing their parents. Well, you could say by the scruff of their necks. In the end, everything we prescribe, everything we do, they don't follow, they don't need it because they see better what's best. And all this is so that the son, for example, would lag behind or the daughter would lag behind. And sometimes when people are already in the hospital, they understand, well, that's it. It's time to stop. What should happen to people? More than that, this is exactly why people stop when, what they see. Unfortunately, we are so structured, our psychologists, that until something is permissible for us, and there are still some chances that possibly will carry us through, we use them and do not stop drinking. When things are bad, they lie in the hospital with some kind of hepatitis or some kind of pancreatitis. Oh, that's it. I quit. I'll start a new life from Monday. When they return home and the pain subsides, they quickly revert to drinking and consuming unhealthy foods. Unfortunately, here, you can instill a person's culture and lifestyle at the snap of a finger. But if you keep smoking using this method, you'll die. Well, so as I don't have to go far, my dear friends, my patients with bladder cancer, whom I perform surgery on, I tell them that they can't smoke. You've developed cancer because you smoke. After the operation, we go to the first floor. It smells of cigarettes from him. He goes to smoke. To my question, why do you smoke? The answer most often sounds no argument. The fact that I show him my articles where I describe that the effectiveness of his further treatment directly depends on whether he quits smoking or not. I show articles about why this has developed in him. I show articles about his prognosis, about how effective or ineffective chemotherapy will be. Most don't quit smoking. Even the presence of cancer is not enough of a stimulus for many to quit. Do you want our parents to listen to us? That's why, in reality, the salvation of those who are drowning is often in the hands of the drowning themselves. Through these videos, my audience ranges from 35 to 46 years old on average. But I hope your parents will also watch me, as it may benefit them too. If they abuse alcohol, it will leave their life. My friends, usually doctors, deal with those who say that drinking is okay, it's not harmful, and those who say that there is no safe dose of alcohol. I believe that indeed it is somewhere in the middle. These are possibly small doses in moderate amounts. What I said is 50 grams. Possibly you will get some benefit, possibly some plus you will get, but the same plus you can actually get if you consume the right food, if you consume omega-3. Therefore, to reduce the risk of atherosclerosis or to get a dose of resveratrol, to consume it when you can get it in the form of a dietary supplement, I think is wrong. Therefore, in my case, my choice is my own. As a free person, it's a healthy lifestyle and a life without alcohol. If you choose a different path in life, that's your right. But you should understand all the pros and cons of your choice. In the following episodes on the channel, I will talk about contraception, their types of effectiveness, and we will also discuss sexually transmitted infections. So subscribe to the channel, and you'll be the first to know about the release of new episodes.